Metabolic and bariatric surgery is the most effective treatment for severe obesity. However, some patients may experience significant weight gain, which undermines the improvements in physical and mental health. Pavlos Papasavas, I'm the Director of Research for the Department of Surgery at Hartford Hospital and the Co-Director of Metabolic and Bariatric Surgery at Hartford Hospital.
Dale Bond, I'm the Director of Research Integration at Hartford Hospital.
We know that physical activity counteracts weight regain, and we hope that with this innovative research study, we'll help patients engage into a more routine physical activity in the long term.
So this is a prospective randomized controlled trial in which we're comparing two different treatments. And so the first is using novel psychological strategies to help patients align their personal values with their motivation to exercise. And then the second treatment is more of a traditional approach in which we educate patients about the role of physical activity in weight loss maintenance. Patients will receive online counseling by trained therapists. They'll also receive additional support in the form of email contact and telephone counseling. And finally, they'll receive a wrist-worn fitness activity tracker so that they can actually monitor progress towards their goals.
Metabolic and bariatric surgery is only a piece of the puzzle. Although it's a very effective treatment, we expect patients to adopt a healthy, balanced diet and a physical activity routine.